Welcome to the channel, everybody. I just wanted to start off with a medical disclaimer. I'm not a doctor. I'm not a medical professional. I'm just here to talk about growth hormone. Simple as that. It'll come in a powdered form, unconstituted. You'll need to reconstitute it. You will pop this cap off. You will take an alcohol wipe and wipe the stopper. You'll do that to your bacteriostatic water. You'll take probably a 1 ml syringe twice, or just once with a 2.5 or a 3 ml. Put it in the top. It should suck the plunger down. Anytime you get a vial of anything, whether it's testosterone, growth hormone, peptides, you want a vacuum seal vial to just show, like, that's just one step towards you're getting a good product that was, used with better equipment. It's probably more sanitary, hoping it's good sanitary. More than likely sanitary if you're getting close to a pharma grade or you got a product that comes from a place with good reviews. That being said, either way, you'll drop 1 ml bacteriostatic water in any syringe that you have that you're using and put it in the vial. When you put it in the vial, you will want to put it in on an angle. You will want to kind of hit this bottom part as best you can without hitting the powder. Let it roll into the vial. You just don't want to shoot it directly into the powder. It is a sensitive product. When you get it in there completely, you don't want to just vigorously shake it. You want to twist it around and kind of stir it in there, or roll it on the table, roll it in your hands gently, but just don't shake it. Highly recommended by everybody. Is what it is, a sensitive product. I've never tried shaking a vial and see if the quality was still the same. So I don't recommend you start. Then you will draw anywhere from 0.1 to 3 ml for weight loss and health benefits. And take that in the morning for weight loss kind of thing, or before a meal. If you're looking for more anabolism, then you are going to take probably a bit more, maybe once, 2 to 3 times a day. Best time to take it is before bed, just because you're the most anabolic when you sleep, and the most growth hormone secretion happens when you sleep. I know you're injecting it, but it will make a big difference just doing it before bed. There's going to be different dosages and different for different qualities of what you might want, whether it be weight loss and just health benefits, or if you want anabolism. If you are looking for more of an anabolism, before bed and before meals, before pre-workout, is going to help with muscle growth for sure. And then weight loss. It does have a bit of a short half-life, but taking 1 to 3, 0.1 to 3 mils, 10 to 30 units in the morning is going to be better for the weight loss part. And then it will help your quality of sleep either way. I've gotten the best deep sleep of my life using it. It is quite expensive. You're not going to just see anything out of it out of 1 or 2 months. 3 months, you'll start seeing a little bit of a different change out of it. Taking it longer, you'll see more of a benefit after that. You can overdo it for sure. Like HIV patients get 18 units per day for their health needs and stuff like that, prescription wise. And again, you can't overdo anything. So it can grow your ears, it can grow your nose, it'll grow cartilage, it'll grow your hands, grow your feet, grow your internal organs, your heart, everything. Bodybuilders that have overdone it tend to get this, I wouldn't call it disease, but this, they get palumbolism, which, you could have a really low fat percentage on your body and still have this kind of gut looking like you've gorged and you've overeaten, and you could have rock solid abs and still look like that permanently all the time. Kind of look like a bit of a turtle shell. It is what it is. You can overdo absolutely anything. It does have a lot of health benefits in the low range for just, having a balance of growth hormone, because as you age, you stop secreting as much of it. And that's part of, it rejuvenates cells, creates new cells. And again, it can grow cancer cells. So all things to be considered. It's not gonna kill you, but also it could induce something that could kill you. If that's something that's in your genetics that you're worried about, just be aware of it. And yeah, low range of things is absolutely therapeutic for your body. Just having that, like, levelness of just the fact that it's in your system when your body might not be creating as much of it. It is anti-aging at that point. If you're looking for an anabolism type state, then it's going to have some sort of aging qualities as too. So just know that it's not like a miracle chemical. It's not quite a peptide. It's kind of on its own platform between, steroids and peptides. But at the same time, it has a lot of health benefits, just like anything else. There's peptides that will induce the secretion of growth hormone, which will kind of do like a therapeutic dose on the lower end of things naturally, where it like triggers something in pituitary gland to create more growth hormone. Like ipamorelin combined with like CJC or sermorelin. If you are taking like MK677, be wary of like, creating like insulin resistance in the body, because get a glucose ometer and check your blood, make sure you're not insulin resistant after taking it, and just kind of keep check on it, because not with growth hormone, but like MK677, because you don't want to become pre-diabetic. That's not the whole point of this. Like, nobody's, gunning down for, I want to be diabetic, that's my goal. Like, you're not looking to create health issues out of this. So again, be careful, do your research, know how you want to add this into your regimen, and be true to it. But at the same time, it's not suppressive. You can drop it if you are worried about being insulin resistant or are kind of getting to that point. You could always throw in something like IGF-1, which would be insulin-like growth factor 1. And that will help kind of create like a loop that stops negative feedback and will in turn kind of keep you insulin resistant. So just something to worry about is growth hormone and insulin do kind of play hand in hand with each other. I really recommend not sourcing out insulin as anabolic as it is. Make sure you know what you're doing with that, because that is, this is a lot more forgiving versus something like that. Try to find good sources if you're going to do it. Make sure it is what it is, and it's going to cost a pretty penny. It is worth every cent. Like, it's definitely does its job. And just be safe, educate yourself, and just I hope this video helps. Really, I do. So leave your questions and everything in the comment, like and subscribe. Thanks for watching. See you on the next one.